Some couples setting goals for family building. How do you know when it's time to seek help from a fertility specialist? So I'm joined by one of those, Dr. Nicole Marchetto. She's a fertility specialist from Shady Grove Fertility, which is in Lancaster. First of all, thank you for being with us.
Thank you so much for having us.
Oh, glad to have you here because this is a difficult topic for a lot of people who want to start their families, expand their families. Why is January like the month people start thinking about this?
Yeah, I think January is actually a great time for couples to kind of reset and think about what their goals are for the year. And I think that there's a lot of psychological benefit with that, as well as just some practical benefit. So many people have their insurance updated. They may want to investigate to see if they have coverage for fertility testing and treatment. But in general, I think it's just a good time to kind of reflect on years past and think about what your resolutions or goals might be in terms of family building.
Because fertility treatments can be expensive depending on your insurance. Talk about, Doctor, when it's time to seek someone like you to kind of come into the picture and help.
Sure. Yeah, so this is a really important point. One thing I would say is that you may not need a referral to come see a reproductive endocrinology and infertility specialist. Many patients can just call and make an appointment, which is helpful because then they can kind of just start that journey when they're ready rather than waiting for, a doctor to give them the referral. But in general, we kind of have guidelines based on the definitions of infertility. One of those is really based on age and time of trying to conceive. So this definition is really sort of built on the concept of fecundity, which is your chance of conceiving in a single menstrual cycle. And I would say that, generally, if you're having regular menstrual cycles and you've been trying to conceive with, just unprotected intercourse for at least 12 months and you're younger than 35, it's really time to seek care. Now, if you're older, the chance of conceiving in any single cycle goes down because your eggs are not as good as they were when you were younger. And so we shorten that time frame to about 6 months. And at that point, we'll certainly do the workup, we'll do testing, we'll do all of that. If you're 40 and above, at that point, we would recommend seeing somebody, immediately, really not delaying, because at that point the eggs are just not as good as they were when you were younger. So so less than 35 to 40, we would say 6 months, over 40 pretty much immediately.
Okay.
Now I will say that there are several other indications to see one of us before any of those things happen. So for example, if patients have irregular cycles, so they're not having menstrual cycles every month, they may be having irregular bleeding with that, bleeding between periods, really heavy periods, a history of endometriosis, so really painful cycles, a known diagnosis of endometriosis is certainly a reason to come in sooner. Patients with a history of infertility in a prior relationship or earlier in life, a history of any kind of sterilization, so if somebody had their tubes tied, or a partner with vasectomy. Patients with a history of cancer treatment, so chemotherapy, radiation, things that may actually decrease their ovarian reserve. And then, outside the box, patients may be, looking to seek care because they may have a history of recurrent pregnancy loss. So they might be getting pregnant, but they might be having, recurrent miscarriages, which we define as 2 or more losses that do not need to be concurrent or back to back. So that would be one reason. Another is kind of wanting to build your family the way that you see fit, needing to maybe use donor gametes. So donor gametes would be donor sperm, donor egg, donor embryo. So same-sex couples that are interested in building their family in their own way, patients who may be single parenting or solo parenting by choice, who want to use donor sperm. These are all great reasons to come see us.
So lots in there that you just unpackaged for us. And let's talk about the first visit, because I think people will get a little apprehensive. What can we expect? What do we need to know? What do we need to prepare for? Walk us through that.
Sure. So I always say that the first visit is actually my favorite because I know, I've been through this with my husband, and we sort of know that it can be really daunting. And I think that when the patient sits down in front of the doc, you really just want to assuage them and make sure that they feel comfortable with, being open about what their goals are. We do a lot of myth busting in the first visit, making sure that they understand that there are certain things out there on the internet that may not be correct. We do a full history to make sure that we know what their medical conditions are, anything that might play a role in this process, prior surgeries, family history, genetic history, all of that. And then I spend a lot of time talking about physiology. I think it's really important for women to know really what happens during the menstrual cycle that makes it possible to have a baby, and what makes it hard. So I think all of these things are important, and we just kind of go through what their personal goals are.
So you just mentioned that you and your husband went through this. You walked the walk that your patients are going through. What advice would you give people out there that want to have that family, but they're having a hard time getting things started?
Yeah, I think that knowing that you're not alone, I would say that that's probably one of the more important things, because many of my patients come for their first appointment thinking that they are the only person that's having trouble getting pregnant.
Yeah.
And that's just not the case. And I think that many times it's, people just don't want to talk about it, and it feels like everyone around you is getting pregnant, but in reality you may not know what they had to do to get there. And so I think that, being open with that and kind of understanding that you're not alone is really an important part.
That's such a good point. Such an emotional roller coaster. I've seen so many couples go through there. All right. Dr. Machado, thank you so much. Congratulations on your upcoming baby number 2.
Thank you. Thank you
coming
very
up next
much.
month. Good
Thanks
to
for
see
having
you.
us.